Sierra Leone in the time of COVID-19. The impact of the pandemic on frontliners, on business, and on our community. This is The Local Response, every week with Vickie Remoe. I'm here with Dr. Mamadu Baldeh, who is president of the Junior Doctors Association of Sierra Leone. He's also a medical doctor at Connaught Hospital's Infectious Disease Unit. And like every other medical professional in Sierra Leone, he's at the front lines of the fight against the coronavirus COVID-19 pandemic. Good evening.
Good evening.
So, how many days have you been seeing positive cases at Connaught? When was your first case?
Our first case came in, I think it was on the 14th or the 15th of March.
Okay.
Since then, we've been having cases. I can't tell the number now, but I think we've seen around 10 of the positive cases.
Okay. What is the most important thing that's on your mind every day when you go to sleep? I don't know if you're sleeping, but if you are sleeping, what is the thing that's keeping you up at nights with regards to what's going on with the COVID-19 crisis?
I think being optimistic, the love for the job, just like all my other colleagues. Yeah.
So every night, when you're like up at night, you're like, gotta stay positive. I have to stay positive. Is that what you're doing yourself?
That's what all my colleagues are doing. That's what we're going through, because if you look at the situations under which we are working, you have to be optimistic. That's the best thing you have to keep on pushing. So we do one by one, go to each room, assess patients, review their medications, which one you may want to change or not. Well, it's difficult to work there because you don't take anything inside. Okay. You have to find a way to keep their information.
Oh, in the infectious disease unit. Yeah. Can you tell me a little bit about when you say that you can't take anything inside of the infectious disease unit where you're keeping potential COVID, like COVID probable and COVID positive cases? Yeah. What does that mean, that you can't take anything inside?
So it's a facility wherein you don't want to take anything in and you don't want to bring anything out, if I should put it that way. So we have suspected cases there, and the idea is isolation center or an isolation unit. The patients there already have something that you do not know what it is. Okay. And some of them may have underlying conditions. Coming out and going in just with stuffs kind of might hurt them in some way or cause other problems. That's one. And two, if they have certain diseases, you don't want to bring it outside to the general people you're going to meet. So you have to dress in a way that will protect you or whatever you have with you from the patient. And at the same time, when you're leaving, you have to take out everything that you were using inside out. So that means even a pen, you have to leave out, or paper, everything has to be out.
Oh my God.
And you go in, and because when you're coming out, you're leaving everything out. So you have a place called a donning room where you get dressed up in your full PPE and all the stuff. And when you're coming out, you do doffing. So you take out everything. That's the
So
scenario.
if you're seeing, I know your facility has like 12 beds.
Yeah.
If you're seeing 12 patients within the COVID isolation units at Connaught, and you can't write down anything about their vitals, how do you remember that? Like, how is this possible? I mean, I know in other countries they have like a digital thing that will be next to the patient, so you can just punch it in, and then there's some database somewhere, so when you get out, you're like, oh, this patient has this. So you're telling me in order to treat these patients, you have to memorize everything about each individual case's vitals until you come out of there, take off your PPE, and then go and write it down somewhere?
Yeah. So we normally do that. I think the main challenge we had was like I said, you don't have to take anything in there, neither you have to bring something out. But there are patients there, and some of them are going to be positive, some of them are going to be negative. Okay. You don't want to do what is called cross-transmission. That's one thing. Okay. So I don't want to be in this room, and possibly that patient is going to be positive. Okay. and write for the patient, use the same equipment, and then take everything again to a person who may or might turn out to be negative. So that cross-transmission is something we wanted to limit as well, which means it's not just about pen and paper. Everything that is in that room should be for that patient.
Okay.
And when the patient leaves, you have to disinfect all of the stuffs. So yeah, you have to see 12 patients. I think in other parts where they have more beds, if there are no ways to record vitals, you will have to keep everything and bring it out.
I'm
sometimes
sorry,
if you
that
get
just
lost,
sounds scary.
yeah, well,
because
it's not just one person in there. It can be
Okay.
2, 3. So you might decide to divide the vitals in some way, or
Jesus Christ.
so yeah. It's nice. You know, salon they don't teach me for cam. So.
No, that's really like I can't imagine being in full PPE. First of all, thinking
Sweating.
about my own. Okay, you know in your mind that you're going into this place that's a high risk environment, right? And you know that frontliners are at risk, right? You know that you have, if anybody's going to get it, potentially it's you because you're treating people all the time, right? So there's that in your mind, and then you go there and then you have to check everybody, put their welfare above your own, and then remember everything about them while you're going from one patient to another, while you're mentally trying to not to cross-contaminate anybody, and then come back, take off all your PPE, come back out
Well,
and
yeah.
treat them.
I do it like maybe 2, 3 times a day, or if there's an emergency. The nurses do it more. So
Wow.
it's a situation. We get used to it, so it's not something.
That is incredible.
It's not something big.
It's not something big. No, please, it is big for us. Please, for me, it is big. Leaving my house, coming to my office, I can't even remember to bring my keys sometimes or my water. So no, that's like really, really incredible, which is why it's so important that people like you who are doing this work have all the support you need, because you need peace of mind to be able to then like store this information and work and come out. What is the most important thing that all Sierra Leoneans need to know today about the COVID-19 virus in terms of how it affects the body, what puts people at risk, contagion, etc.?
So in terms of message to Sierra Leoneans, I think we have to accept that we do have COVID. It's not a built-up story. Some people think having COVID, the patient will die or something, or there are lots of stigma, and looking around on TV, seeing people dying. So COVID actually have a very low mortality, very low number of people will die. Okay. I had a confrontation with a patient who, not the patient, a relative. So the patient comes positive, and I had to tell the relative. And the relative was angry. It's not possible. The patient is looking healthy.
They're not sick.
They're not
sick. They're not sick,
and let them can get the sick and all those things. So I think we have to accept that COVID is in town, and not everyone is going to be affected the same way as others. Okay. So we have certain things, or certain people have underlying conditions that make them severe. Okay.
Can you explain in a simpler term, because I think people hear the phrase underlying condition. But most people in a salon don't really understand what it means. When we doctors say this person get underlying condition, what does that mean?
So you get people generally who are healthy. They don't have hypertension, they don't have diabetes, they don't have any other condition. Maybe they have malaria once a while, or maybe they have some kind of infection once in a while and they get treated. They are fine. Now you have conditions which are referred to as chronic conditions. You cannot treat them, you only manage them. You live with them throughout the rest of your life.
So you're 70 something, you get diabetes, you don't get diabetes for 30 years.
Yeah, so you can manage the diabetes.
So diabetes would be like an underlying condition.
It's an underlying condition. If you get blood pressure high, been high for a long time, so becomes a long-standing hypertension, so that's an underlying condition. Some people have asthma that they cannot manage. So if you have this condition, some people have, for example, end-stage kidney disease, like they need to be doing dialysis. That cannot go back. So those people, if they get infected again with another disease, for example, COVID, we say they have an underlying condition.
Okay.
And the COVID will make them worse. Okay? And these are the people who end up needing ICU or very critical care.
Okay.
And it's among those people you have the mortality most of the time.
Right.
But for young, healthy people with no underlying condition, no hypertension, most of the time they only present with mild symptoms, sometimes nothing at all. Maybe they come to the hospital for a headache or something and the doctor decides to test them and they come out positive. Those are not, well, I wouldn't say we're not worried about them. We do worry about their own state, but what we want is for them not to transmit the virus to other people who may become vulnerable. So you have people who may show no signs, some will show just mild, they do not need admission, and even if you take them to the treatment center, they will just be there playing with their phone like, I'm not really sick, you know,
right.
and they would not believe that they're actually sick, having seen what's going on in the TV and all those things. But yeah, so the mortality is very low and only few percentage of people will end up even dying, you know, so for 100 cases maybe you will see 2 or 3 deaths. The problem is in other countries you see thousands of deaths. They've already registered hundreds of thousands of cases.
Right. But so the percentage is low.
Very small.
It's just that.
Yeah. So if we continue to have 100 falls of cases, we'll be seeing more deaths. But then if we're having low number of cases, the hundreds, we'll be seeing single digits and so on. Okay. But
how do you feel about your facility's capacity to respond? Like, what are your challenges and where would you like to see things change or evolve? Or do you feel like 100% confident, don't worry, we've got this under control, which I'm sure you do in some ways, but I'd really like to hear what the reality is for you guys right now.
So Connaught Hospital is like the main referrals facility for adults in the country. You will definitely see cases, some COVID, some non-COVID, and it also have one of the biggest isolation facility, even though it has 12 beds, compared to most of the other ones have 6 beds in other parts of the country. So we're seeing lots of patients, and sometimes the bed gets full and we don't know where to put patients. There is a possibility that we might expand it. The problem, it cannot be changed to a treatment facility because we have other patients that need attention who do not have COVID. So that's one thing. 12 bed, it's small because most of the patients will have to come to Connaught and would need to be isolated and before they can be taken to treatment center. So that's a challenge.
So
in terms
space
of
right now is a challenge, that even if to isolate them, because if you have 12 beds full, you can't take any more people.
You can't take any more.
So what do you do then when you have nowhere? What's the plan?
We'll try to look for other isolation centers and see if they can be isolated there. And I think that's the rationale we're trying to work with. So that's one challenge in terms of space, but I think the hospital is looking for ways wherein we can maybe add more beds.
We don't have space.
And it's challenging because Connaught, most people go there because they're seriously ill. People just don't get up, I want to go to Connaught, and because of that you'll see very severe cases, and the mortality may of those who come there may be severe because in a situation wherein people have gone everywhere, gone to traditional, and then they only come to Connaught as a last resort, there is very limited most times we can do. So you will see a huge fraction of those who passed out have come from Connaught for COVID. It's not because of the facility or the professionals there, it's because of the state at which they come in. There's little they can do. And secondly, the disease, still we're trying to find ways to treat. It's not like there is a definitive treatment that we go by. So these are some challenges we do face. But the patients we do admit there, even though they are severe, we try to give them the best care we can get. It's been challenging. Like I said earlier, we want to prevent cross-transmission. We want to make sure they have their drugs. So the challenge comes in wherein we may have just one thermometer or one BP machine or 2 pulse oximeter. That has been the challenge so far. Patient comes in with no money and we write a prescription. They can't get drugs because they don't have money, so we have to outsource somewhere. But thanks to God, we've been having good people. Now the 12 beds have all the vital signs we need. So you, as a doctor, I go in, I do everything I want to do in the room, check the pulse of the patient, check the oxygen level, check the blood pressure, the temperature. The only thing I need to do now is just keep them up in my head. Yeah. So I can safely leave that patient, change my gloves, put another, and then see another patient. Everything in that patient's room. So I think that is. We still do have challenges in terms of emergency medications, but I think from the first case to now, we've moved a bit better, and with time to time we do more organization and see how things go.
Okay, that's fantastic. How do you feel about our capacity to fight this disease? Do you feel like this is the kind of thing that we should all just start being really, really worried, or are you confident that this shouldn't overcome us and overpass us? And if you feel like it shouldn't overcome us, what do we need to do to make sure that we really take control?
No, I think as time goes on, we'll see certain changes happening in different facilities. Some new facilities will come in, and maybe in the future might even include some private facilities to join in. But that depends on the number of cases we see and how extensive is the community transmission. We do not want community transmission since the start, and we've been trying to push and see how that can be stopped. But there are lots of factors involved in that, which I don't want to go into. Of course. But I think we're seeing more cases. The challenge is already there. Most of the facilities are getting full. Treatment centers are full. Isolation units are getting full, which means we'll have to look for spaces somewhere. And as time goes on, we may have to redefine severity of those who will be admitted and those who maybe will go to quarantine homes or go to their homes and self-isolate. So as time goes on, I think things will change or modify to suit the number of cases we do have. The challenge is always going to be there. We do not have lots of hospitals. We have a limited amount of CHCs, and most of them do not have isolation units. And most of the big hospitals we do have, we're not just going to say, let's admit, for example, Connaught, let's just admit everyone as COVID. Right. It's not going to work that way. So what you want to do is make sure the normal activity of the hospital is going on, and at the same time the isolation unit is functioning. And if we can get that working, there are designated treatment centers. For example, the government hospital have been designated that is going to be a treatment center. There are some modifications that need to be done there as well to expand the capacity. But like I say, with time, as the number of cases come in, we will definitely do some rearrangement and restructure. Now for the general population, like I say, the communication aspect in this fight have some gaps or lapses.
I'm glad somebody said it, because if I say this, I'm going to say it because I want to say it. But please tell the people why there's a problem in comms.
Like I say, I believe we should not be going through this again, because we're just coming from a similar situation. And it's a continuation. We learn and we apply those things. Certain things we should get past now. Now we should be thinking about how we should have modeled the ones we have to suit better. But there is some communication gap. I don't know where, how, what's going on, but that needs attention if we're to get the people the right information, and so people can take this thing serious. Okay, we don't expect people in the streets to just believe some kind of thing. No. And the worst
especially
is,
when not like Ebola outside person, they get blood and this, that. So yeah,
the kind of a disease wherein somebody will get it and be walking around and you just want them to just believe. No, it doesn't work that way. So that's one thing. And secondly, if you begin to give conflicting information, you're just affirming their fears, like, oh, Dandy said this yesterday, this say. It doesn't help, okay? So they need to address the communication issue. And in medicine, the way we communicate is totally different from the way you people
well, talk to us in the medicine way,
so there are
maybe
certain
that
things,
help us.
There are certain things which is for the medics, keep them prepared, know what they're going to do, what they're going to fight, how they're going to fight it. This is a health information exchange, which is, the medics should have it, okay? I need to know what's going on at a particular treatment facility, how they're treating it. So if I see a patient, I know
you
how
can
to
also
do it.
pass
These are privileged conversation, limited, and it goes about ethics is preserved. And at the same time, we know what to give to the people, how to give it to them. We've been breaking news of dead people for a long period of time. So the way I'm going to tell you is different from the way you're going to tell me about
of course.
So there are certain things that needs to be looked. And we have lots of specialty in the medical field, public health, etc., which involves not only epidemiological aspect, but how to communicate with the people and tell them how to accept information, how to inform them of a community transmission in a way that they will believe, even if they haven't seen it. So I think that aspect is lacking in terms of communication.
So you feel like in the comms on COVID to the public, the health information aspect is missing in a way that...
There's lots that's missing there. and you wouldn't take me to do your job.
Of course not.
I'm going to...
Of course not. Of course
I'm not going to give you what you require.
Of course not.
So those are the things. I think if people are listening, they will understand what I'm saying. But if you want the people in the
masses,
everywhere in the streets, everywhere,
people on the streets,
we need to develop. I don't know if we do have it and they're not applying it, but we need to develop a strategy to get everyone
The
to
government
listen.
of Sierra Leone actually has a One Health risk communication strategy, which was developed and launched last year in August 2019. It is an amazing document because it includes all the potential channels, inter-MDA, cross-sectoral work, all the channels, who should do it, how they should do it. It is there. It was paid for by USAID, and it is a brilliant document.
I'm not saying I'm supposed to know about it.
No, you're not supposed to know. You're not supposed to know.
About it.
I just want you to know that the information is available. Government has it. What's missing is the implementation. I think, unfortunately, one of the key challenges in Sierra Leone is that we invest in capacity building and we invest in tools and research and stuff. And as long as donors are paying for it, we put it together in a binder and we put it on a shelf. And the next time
that's not capacity building.
No, it's
that's
not.
The process.
Yes, the next time there is a problem, instead of going to check and say, what is our archive? Do we have this thing?
You start all over again.
You start all over again because usually it's an opportunity for people to spend money to now do assessments, survey, this, workshop 1, day 2, day 3, day 4, move people, okay, another workshop, let us mobilize, and then let us apply to Ministry. I don't want to go up, but basically, if there are gaps in communication right now in the ways in which they're talking about this, it is not because the government does not have the tools and resources. I feel like these lapses, especially, and I hate to bring this up, but like, you know, that woman who was reported as dead, but then she wasn't dead, the language that was used to talk about her, just the whole thing,
So that one was personal to me because I saw the patient. Maybe I should not say that here. But I saw the patient, admitted the patient, suspected COVID, was admitted into the IDU. Patient was okay. Test came back positive. And I was in the facility when the ambulance came, took the patient. The patient walked into the ambulance and left. Just maybe a few hours later, I received a call from a colleague, and he was saying, so and so. I said, no. A colleague called me and said, because I was not with my phone, I had to check my phone. Like, so, and I saw the call, I was like, okay, let me respond. And it was like, oh, you heard about this, blah, blah, patient, a Connaught or something. I said, which patient? Say ages. I said, no, that person left by an ambulance and walked into the, and so he was saying they reported death. I said, it doesn't make sense, but possibly we start thinking of clinical things that may have happened on the way.
Something you don't know, something all kinds of things happening to us.
Do you understand this kind of thing? And I decided to check my group, my medical forum, and there were many questions like, why this happened? You know, I feel like, what's going on? Like, what have I done wrong? You know, this kind of thing.
Yeah, like you felt like maybe you missed something.
Missed something that you understand.
Died,
So I had to go like, look, this patient was here, and there was a comment where someone post, I think it was from Facebook, maybe the doctor doesn't know a dead person. You know,
Maybe
this kind
the
of
doctor
thing.
doesn't know the person died.
Or
Wow.
you understand? So there were lots of things that
Right.
got me like, what happened?
Right.
But I saw the person going into the ambulance and all those things, you know. And I had to tell them, like, the patient left there. I don't know where they took. Well, they told me they were going to take in a particular facility.
Sure.
And I assumed the patient went there. And so that night was a bit rough because I was staying at the hospital and I was just thinking about it. And
so it affected you, like, psychologically.
Of course,
you were like,
you know,
felt like you had made a mistake and potentially
that I could not.
Yeah.
And the issue of, like I say, Connaught see most of the patients, you know, most of them come in very severe. And most times there's very little we can do. Not because of the personnel, because of the infrastructure,
Right, you don't have
because
the capacity.
and all the other things I mentioned, medications and those things. So no one wants their patients to die, okay? And to hear news about something that happened that
someone that you thought was okay and not severe.
So it hit me well. The next morning I woke up again, let's go on.
Yeah.
And I received a call from a senior who was trying to ask questions, and what I said,
Are you managed to kill the super?
No, like, tell me more about the
happened,
patient
the case,
or something.
yeah.
So I have the chat here, and I went through the chat, reading and everything, and he said, I don't think the patient passed off. I think there was some communication issue. I said, please, don't tell me that. And he said, yeah, and blah, blah, blah. So I just closed the chat and went back to my work. Like I say, certain mistakes in medicine is not acceptable.
Right.
It's not acceptable. Like, you can be in big problems if certain mistakes you commit as a medicine, as a medic, you know. So certain things is not about apologies or something.
Yeah.
That's why I say there's some problem with communication. Yeah. And in times like this, we don't want that, because you want the people to get the right thing.
Absolutely.
So if I'm going to tell a patient relative that, hey, this person will look well, so he gets this sick, I want to believe. I don't want her to start thinking, not so you know, be that person will miss that person say he gets I not get him, or that person will die and not die.
Absolutely.
You know?
Yeah.
So we don't want that kind of thing. That is why you don't make those kind of mistakes.
So thank you so much for, you know, telling us about your plight. I'm personally really, really proud of you, and I think that every Sierra Leonean you guys are like our soldiers right now against an enemy that we can't see. But, you know, after talking to you and meeting other young doctors and just engaging with you guys, I just feel like if the country as a whole and government facilities and government leaders listen to young people like you and empower you to act and let you lead in this fight, that we will have a really amazing chance in beating COVID. So thank you so much for your service.
I can say lastly, just 2 messages.
Sure.
One is generally the healthcare system should be a priority for every government in the world. This has been the singular most event that has disrupted everything, economy, social life. And so it is not just during crisis that the healthcare system should be remembered. Absolutely. It should be a topmost priority for everyone. And to the people of Sierra Leone, COVID is real. You may be feeling well, but you may have it. The best we can do is go by the measures that the government have put in place. Going out, use your mask, always wash your hands, or have a hand sanitizer, and the personal hygiene etiquette, sneeze in your hand or cough in your hand, that will minimize the spread, and you will save the older, loving generation. Thank you. That was Dr. Mamadu Baldeh, who is a medical officer at Connaught Hospital's Infectious Disease Unit. He is at the front lines of the fight against the coronavirus pandemic. It's really important for all of us to understand that this disease is real. Just because you possibly not get symptom, not mean say you're not positive. So still continue for what you are. Wear mask if you get for go near person, you get for go near streets. And definitely, if you see you get any symptoms whatsoever, even if you're not sure, say if na COVID symptom now, or you just feel like, I know they feel off, call 117. Talk to them at the phone, because they get people that they were trained, we go able to direct you to nurse or doctor or caseworker, we go able to confirm you and tell you exactly what to do. Thank you so much for watching, and see you next time.